Um, Let me check if we are live or not. I think we are live, but we'll just do a quick check. Let me give me a second. Yeah, I think we are live. Yeah, good. Okay, welcome to Namaste debate, everyone. Whoever is able to join and see this live Facebook live session. Today, I'll be having conversation with Dr. Sajeev Ampadi. He is a practicing homeopathy doctor. Welcome to Namaste debate, Sajeev.
Hi, Namaste, everybody.
How are you?
Good, good.
Good.
How are you doing?
Yeah, not too bad. Thanks for asking. So I will just start by asking you to introduce about yourself and just say all the good things about yourself.
Okay, thank you very much. Like my friend Mani Nair told, I'm a practicing homeopathic practitioner in Canada, basically a registered homeopath. So I came to Canada in 2014. I was working as a consultant in some hospitals in the Middle East and India. Basically, I was a visiting consultant in Atlas Hospital, Muscat, Oman, and then I was a consultant in a couple of other hospitals in India. I worked 25 years back home. Then I thought of migrating to Canada because in 2014, a big thing happened in Canada. Government in Ontario, government regulated homeopathic profession. So homeopathy becomes a regulated healthcare profession in Canada, in I would say in Ontario in 2014. So I decided, because I worked in many other countries, but I would like to basically um, uh, get a good fortune, or I want to see more. I want to explore more. I would say I want to explore more in the opportunities in Canada. So I decided to migrate to Canada, and then I came here. Then I within like probably in a couple of months I got my registration. The first a few registrants in Canada. I was one among the first. I would say I think one among the 50s, if I 50 registrants when government regulated here. Then from that day onwards, I established my clinic, and then it was basically 50% of my time I was teaching, because homeopathic profession was emerging here. So basically, I need a more. I need to have a good team here. So I thought of investing my time for teaching. So that helped me to refresh and brush up my memory a little bit in my academic memories a little bit more. So I spend my time on teaching, and still I'm teaching. Like I would say now I'm like 25% time I'm teaching, but 75% time I am working on my clinical practice. And I worked with and later then I worked with the Regulatory Council of Homeopathy, and I contribute a little bit to that council, the government regulatory council in the regulatory framework. And then I think in the last April I stepped down from that. Then now majority of my time I'm in clinical practice and teaching. And by the time I was interested with the Canadian Red Cross, because there are some teaching opportunities in Canadian Red Cross. Then I basically worked on um, lifestyle diseases and cardiology back home. So I thought of investing my time on teaching the basic life support. Basic life support means cardio and respiratory rescuing algorithms. So I'm teaching those things, and the cardiopulmonary resuscitation areas. So that's another thing I'm doing. And I'm enjoying the Canadian life, I would say. I like it.
Okay, good. So how long you have been practicing now? Like overall, like how many years now?
Overall, it's almost, I already completed 25 years of my clinical practice in total. Um, Basically, in my life in India and Middle East, my practice was so crazy, so hectic. Um, India being a highly populated country, naturally the patient input will be higher compared to Canada, because Canada, the population is low. So patient input will be less. So I can invest more time on working on cases, patients' history, and in working workout. Basically, I can do more clinical workups in patients. But there are good things in the hectic practice in India because I get more clinical exposure. I was exposed to pretty much all the cases there because variety of cases were high and patient input were high. So that gave me a lot of experience in my, as a clinician, I gained a lot of experience. That I am missing here, but I get more time to work with individual cases.
Okay, okay, that's good to know.
Mhm.
So before we go to the Q&A session, I just want to ask, how you have been like overall, like since March pandemic, how your experience has been, right?
It is a really hard time for everybody, and it's for me as well. It is the same. And in the first months of and the early time of pandemic, a lot of patients came to me, even though there was virtual. I was offering virtual consultation during the first lockdown time. Patients basically, patients. I found that patients they have a fear to go to the medical offices. They hesitate to go to even emergency because of getting exposed to COVID. So a lot of misconceptions were there during COVID. When we look back into the 2020 March, we can see that nobody
Right.
were wearing masks, but they were wearing blouses. So the idea of droplet infection was not there that much. So even we can't blame anybody for that. We can't blame the doctors or the medical researchers because we do not know. We never knew about this virus. We don't know what's the type of transmission. So we thought that through the contact, by physical contact, the formite transmission was the major cause. Even in the Walmart, groceries, everybody were walking without mask, but they are using gloves. Crazy buying gloves. Then lately we found that masks are more important than gloves. So what I did is I set up a really good virtual consulting office, really good, with all the cameras. That means my patients will get the real feeling that they are sitting inside my office,
Mhm.
like high definition cameras and all the other systems. I set it up here. Then I put a drop box outside. After consultation, they can come and pick up the medicines from there. And the hand
Okay.
sanitizer, all the things were set up there. So um, it was a big impact. It had a big impact on patients. They really liked it. And a lot of patients came to me because of that. And I gave a small um, like social media post about the setups in my office. So a
Mhm.
lot of other practitioners they copied it, and from that day onwards, I think that I was able to help a lot of people because they, for their complaints, they don't need to go to hospital. They don't get exposure. I get all the COVID precautions I was observing 100% in my office. So all the
Mhm.
chairs, everything sanitized. When I started receiving patients, I said I have all the mandatory questionnaires, temperature check-in, everything set up here. So, and many patients were asking for immune boosters, like anything that could increase their natural immunity. So I could help them in that area. So I'm happy, I'm satisfied with what I have seen during pandemic. And of course, I have seen many COVID-19 cases virtually, because like everybody, we know that majority of the milder viral load infections will go by itself. We don't need any like supportive
So
treatment.
we'll
Like
talk about that one. We'll talk about that as we go through the Q&A
yeah, yeah.
session,
Okay,
right?
I
So
understand.
I just wanted to give a general idea to everyone watching this live. So we're going to talk about homeopathy medicine, and
Okay.
how is it doing in Canada. We'll talk about general health and
Mhm.
health awareness, about diet,
Yeah,
and we'll end the session talking about aging.
yeah,
And
that's
I'll
great.
basically I'll basically learn from you only that aging is now considered as a disease. So we'll talk more about that.
Okay.
So we'll start with homeopathy. And if you're ready, just let me know you're ready.
Yeah, I'm ready.
Okay, good. Okay, my first question is about the homeopathy origin itself. Can you talk a little bit more about the origin of homeopathy and the influence of homeopathy medicine in the world right now?
Homeopathy is one of the is I would say the second preferred alternative system in the world, especially in India. There is a lot of government homeopathic colleges, government homeopathic institutions, and research centers are there. In Canada, it is emerging. Um, so it has a really good future, I guess, because, but I want to rephrase it. It's not an alternative system. It's basically a complementary system of medicine. I'm not
Mhm.
claiming it as an alternative, because there is no alternative for the healthcare system in Canada. It's there. It has its own role there. So, but there are
Mhm.
many people, they need or they want all like complementary systems. Sometimes they want to. There many diseases they are taking medicines or for a pretty longer time. So they want something like less harmful, something that they're more natural. So its popularity is really gaining across the world every year. Many new patients are coming to try homeopathic medicines, and basically we have a lack of human resource in
Mhm.
homeopathy. We need more practitioners to deal with the emerging demands.
So, did the homeopathy medicine basically origin in Germany, or it came from somewhere else?
Yeah, it's in the origin is from Germany, and by then from Germany it spread all over the world.
Hmm.
The founder or the father of homeopathy was Dr. Samuel Hahnemann, and he was is a German physician,
Hmm.
and he was a modern medicine physician at that time, and then he
Hmm.
switched to homeopathic treatment. Because he basically invented the system,
Hmm.
and later on there are many followers and many new physicians switched to if you look at the first generation, all of them
Hmm.
are switched from the allopathy side, and then later
Hmm.
homeopathic practitioners, they studied homeopathy and they came into profession, and still there are other discipline doctors interested in homeopathy, and they are practicing homeopathy.
Okay. Okay, good. My next question is, I want to ask you, what are the main differences between allopathic medicine and homeopathic medicine, and which one is more effective, or both have their strength and weaknesses?
Yes, both has its strength and weakness. They are entirely different. Homeopathy and the allopathy, they are entirely different. And homeopathy is basically trying to um, increase the natural defensive power to the diseases. That's the basic concept. So the medicines are basically stimulants. It's not directly attacking on the diseases. If there's a pathogen, homeopathic medicines are not going to kill the pathogens. So it's naturally enhancing the defense system and the repairing mechanism of the human body, and then conquer the disease. So that's the treatment method of homeopathy. But allopathy is basically 100% based on the pathology, and just reverse the pathology to the normal. So whatever molecules we could use for reversing it, that's their treatment modality. Both has its strength and weakness. I would say I'm not an expert to talk about the weakness of the other systems. And in homeopathy, basically the strength is it is harmless. It's very mild. It's not going to make any side effects in the human body.
Okay.
And the weakness is it's very hard to deal with emergency medical conditions. We cannot do, and major issue is we are not equipped in dealing with that. Modern medical system is not just molecules given as medicines. It has a lot of supportive equipments and gears there, like oxygen and surgical equipments, a lot of things. It's basically engineering. A lot of engineering things are there. And if we have those things in our institutions, then we could have done better, and we could explore those things. But currently, in homeopathic system, we don't have an opportunity to access those things. In Canada, especially because of the regulations. But in other countries, like some other countries, the regulations are different. There are all the equipments inside the homeopathic hospitals.
Okay. Okay. So right now here in Canada, we have homeopathic clinic, right? But is there any hospital? No, I don't think so, right?
No, we don't.
Okay.
There is, from my understanding, there is no inpatient facility here.
Okay. So that brings me to my next question. In general, what illnesses can homeopathy medicine can cure?
Pretty much every disease we have a treatment, because we are targeting on the human body's power to cure the disease. But if it is a florid bacterial infection, like a heavy bacterial infection, it's hard. For example, like pneumonias, it's hard to treat pneumonias. It's very hard to treat like pyogenic like pus-forming skin infections. Those are all still hard to treat. Tuberculosis, hard to treat. There are many diseases it's very hard to treat with homeopathic medicines. We may get results, but it's pretty hard, very challenging. But on the other side, most of the viral infections, lifestyle diseases, really good. We have a really good treatment for lifestyle diseases like obesity, high blood pressure.
Can you provide some example, like what kind of?
Sorry?
Can you provide some examples of the lifestyle disease, like?
Yeah, lifestyle diseases are basically obesity, high blood pressure, diabetes. These are the three major lifestyle diseases. So we have really good treatment for.
So you see a lot of cases here, like in Canada.
Yeah. Canada, we have a lot of cases in that direction, and pediatric illnesses, we have a lot of treatment, like kids' diseases, their learning issues. Sometimes they're and then cosmetic treatment, of course, like hair fall. Then a lot of patients are there for looking for aphrodisiacs, like male patients looking for men health issues, like erectile dysfunction, those kind of issues. There's a big area that we can work on. Infertility is another area that we can definitely work on. There are a lot of papers published across the world in the treatment success and statistics of these treatments, these areas.
Okay, good. I don't know if I've told you or not. My grandfather, my mother's father, he was a homeopathy doctor.
Okay, great.
Yeah, in Toronto. Yeah.
Yeah, yeah.
So my family, like 90% of the medicine we took were mostly homeopathy in India.
Yeah, that's interesting. Yeah, you once mentioned me about that. Yes.
Mhm.
Mm.
Okay, so my next question is about the homeopathy medicine influence, like here and other side of the world, especially in Europe. In a in a 2014 survey, 60% of Germans reported trying homeopathy, and
Mhm.
same in France. How is this compared with Canada? Like, what is the adoption rate of homeopathy medicine here?
Basically, from my understanding, Canada is basically, we could see all those population here as well in different proportions. So
Mhm.
the popularity in France and popularity in Germany, that will reflect in the same percentage in Canada as well.
Okay.
So on top of that, other Asian countries, immigrants from Asian countries, they also prefer a homeopathic treatment. But um, even though they were all looking for homeopathic treatment, the main challenge was um, medicines were not available here before 2014. Most of the medicines it is hard to get medicines, quality
Mhm.
medicines, and it was very hard to get licensed practitioners like with expertise in homeopathy. But from, like I mentioned, from 2014 onwards, after the regulation, its popularity increased, like skyrocketed.
Mhm.
I'm not able to say the percentage because there's no proper
Mhm.
statistical data I have. But every day, I would say, every day it is the popularity is increasing. From my personal practice and personal and from my clinical office experiences, I would say it's daily increasing the demand, and they are crazy searching on Google for a practitioner.
Mhm.
And yeah, so from the Google hit statistics in my office, I could see that how many
Mhm.
people are searching for homeopathic
Oh,
consultation
okay.
in my city. So that means it's gradually increasing. Government has to pay more attention to that area because there is a huge demand.
Mhm.
So when there is huge demand, there's a chance for losing quality.
Mhm.
So the quality control and the training and skill of practitioners, all those are under the regulations, but they have to be more stringent in those areas.
So the most of the medicines that we get here, are they imported or we also have a in-house production here in Canada?
I would say 90% is in-house now.
Oh, okay.
There are a lot of manufacturing companies in Quebec-based.
Okay.
In Ontario, we have a lot of other manufacturing units. Lots of companies are operating. Even in Mississauga, there's a big company. There are a lot of manufacturers, and basically, we do not need to import medicines from other countries now because
Oh,
that
I
much
see.
self-sufficient Canada is. And I would say India, when I compare to India, because India is one of the major hub of homeopathy. Now, many medicines which we struggle to get in India is available in Canada now.
Oh, is
Plenty,
it? Oh, okay.
yeah, it's plenty. It's even in in any quantity you can get it.
Oh, is it?
If I need a medicine 5 liters, I can get it in 2 days. And
No,
in a very in a specific in a particular medicine, that much supply is there, and because of the demand, it is increasing. The supply is increasing, so that's really good.
but is that known in India? Like people, like the practicing doctors in India, do they know that Canada has a lot of capacity in exporting or importing this medicine?
Yeah, they are aware, but from a homeopathic practitioner, they cannot just come to Canada and practice here because
No, I
the
mean the
other,
medicine, like
yeah,
export of,
yeah,
like you mentioned in the
medicines.
capacity.
But there is no. I don't think is there any medicines imported from India to Canada because we have everything in house here.
Are
From
we exporting here or to India or
exporting,
limited?
I don't think we are exporting from
No,
here.
okay.
But import from Germany is a huge quantities imported from Germany and from France as well.
Okay.
Because German medicines they have a like a track record of quality of because it's originally a German
Oh, okay.
system. So still a
Okay.
lot of people really trust on German brands.
Oh, okay.
A lot of still import from Germany is still here, and from France because some of the manufacturers from France they are very popular. So um, patients sometimes demand we need that particular brand. So then yes, otherwise we are it's almost self-sufficient in Canada. We
Oh, is it? I didn't know about that. Okay.
are.
Okay, that's good to know. So that brings me to the next question, which is okay, we know the medicine is available, we know the doctor is there.
Mhm.
Now, for the patients, cost wise, so my question is related to that. I read in Germany and France, homeopathic treatments are prescribed by medical doctors, covered in some form by the government medical plans, and
Mhm.
available in pharmaceutical pharmacies. How is
Yeah.
this in Canada, like in terms of reimbursement for the
In
patient?
Canada, there are some medical doctors prescribing. Um, they are I would say recommending homeopathic medicines, but because of the regulations from 2014, um, they cannot claim themselves as homeopathic practitioners.
Mhm.
So there are legalities. So if they want to, but they have to get license and registration and to become a registered homeopath to prescribe and claim themselves as a registered practitioner. So that's there, but
Mhm.
yeah, in Canada there are from other modern medicine doctors are still practicing here. Germany, yes, there are a lot of
Mhm.
modern medicine doctors are still prescribing homeopathic medicines there. Yeah.
Oh, okay. Okay,
Hmm.
good. Uh, my next question is about homeopathy and allopathy. There's a big conflict going on in the Western
Yeah.
world that homeopathy is not has not scientifically demonstrated sufficient effectiveness, those kind of thing. On the other side, I also see that a lot of people who trust homeopathy. So that means my understanding is maybe something is not working with allopathy medicine. What is your
Hmm.
take on this? And I'm just sometimes wonders why there is not much research going on in terms of proving whether it's effective, not effective from the homeopathy lobby side or from the medical professional side.
Yeah. That's a good question. I agree that there is a lot of issues with research in homeopathy, and research in homeopathy is not adequate. There's no question. In terms of proving and effectiveness, efficacy, we need more research. But the main issue of research is funding, and
Mhm.
we need really funding from some agencies to do research. That's one thing we are really lacking. In many other countries, there are government-funded research institutions. They are publishing, doing researches and publishing papers. But the issue is Canada being a developed country with high standards in research and especially in the medical research. Many of those research works are not uh, agreeable for the Canadian environment. So we have to have really good research studies in Canada. So now I'm teaching in a homeopathic college in Brighton, so it's homeopathic school here. So we already formed an ethical committee and other research framework now. We are working on it. And there are some funding that private agencies are willing to invest on it. So hopefully, I'm just hoping that we can do. But my researches are basically on lifestyle diseases, and we have to have research in other areas as well. The major issue with homeopathic research is the entire the research in medicine changed into a new platform in the last 10 years. Now it is evidence-based medicine, EBM. So that changed the entire thing. So the evidence-based medicine, we need always some placebo-controlled trial. There's a group of people in the research not getting the actual medicine. They are getting all the placebos. And the other group of people are getting the actual medicine. And we have to do the whole statistics to prove that this is working. If we give a medicine to a patient, and if 10 patients, if it is working in 10 patients, 8 patients, we cannot claim that that's really working. We have to have another 10 patients receiving placebos. So that's a big challenge. So in homeopathy, we are now making the new platform like EBH, evidence-based homeopathy. And the same system we are trying to adopt here. So that's a huge process. So I am really hoping, and I'm really I'm optimistic that it will come in, but it will be a big thing in homeopathy. If an evidence-based homeopathy research, if we can do something there, it will be a really, really great thing.
Okay, so that's good to know. There is more things are being done in terms of research and validation. So my next question is about the ingredients. So in general, what are the general ingredients that are being used in homeopathy medicine compared to allopathy? Like, what is the fundamental? If you want to talk high level about it.
Yeah, so the ingredients are basically from all the plant sources, animal sources, mineral sources. We have medicines from all the sources. Basically, it's not one single molecule like in allopathy. It's like if they are prescribing one medicine, like if it is like a paracetamol, it's a paracetaminopheno. That's a one single molecule. So it's very clear. It's not complex. But in homeopathy, we are not using such individual molecules. So there's more composite, complex things. For example, it may be a plant extract. So it has a lot of alkaloids. Then there's a process of potentization. So it's a kind of homeopathic potentization process it has to go through to increase the power of the medicine. So that's a specific process. Then we have to categorize into different strengths. Then it comes to the market. So from plants, it comes from many animal sources, and surprisingly, you may say that many even allopathic medicines are the same molecules are there in homeopathy as well, in a different potentized form. For example, digitalis is used as a cardiac remedy in allopathy, and digitalis is a medicine in homeopathy as well. So, but the applications may be different. It may be used for another purpose for one. It's a certain type of use in allopathy, but it can have a different use in homeopathy. Another example is the quinine, the hydroxychloroquine. It was used during this pandemic time. It was a big discussion, and then it was found ineffective. So they are using in homeopathy and allopathy as well, but for different, sometimes for some of the same conditions. But it is not the same molecule. The source is the same. It came from the same source, but the process of changing into a medicinal medicine is a two different process.
So who is actually doing the validation? Like, how is this evolving into new medicine? Like, how much research is going in making new medicine, or is it the same traditional medicine that is continuing, or how does that process work?
New medicines are added every time. So when homeopathy was originated, I would say in the original homeopathic pharmacopoeia has only like very few medicines, like I
Okay.
think like hundreds or something, in hundreds. Now it's like thousands of medicines are already included in homeopathic
Mhm.
pharmacopoeia.
Mhm.
So different countries have different homeopathic pharmacopoeia, the list of medicines. In Canadian pharmacopoeia, there are medicines, and they're common in most of the countries, but some medicines may not be approved here. Some medicine may not be approved in India or in the United States. So each country has homeopathic pharmacopoeia of their own.
Oh, okay.
There's a little bit overlap, and sometimes there may be some issues, but
Mhm.
that's all by the government and the regulatory bodies. They have to do the quality control and everything.
Okay. So does the generally when you give the homeopathy medicine, so based on my personal experience, one is like a small capsule, the other is a liquid format. How does the liquid format work? It's a combination of multiple medicine. How does that work?
Um, may not be a combination. There are combinations available, but basically, it's all are single ingredients.
Okay.
Liquids are there. Sometimes comes in pill form. Sometimes these pills are being medicated by the liquid. So
Oh, okay.
sometimes the pills are just a carrier, just a vehicle.
Oh,
In that
right.
vehicle,
Okay.
that liquid is added and it absorbs it. But
Oh,
there are other tissue salt medicines comes like pill form itself, like some
okay.
medicines taken from the some mineral kingdom, like some tissue. It's known as tissue salts. They come
Mhm.
like tablets. They we don't need to add any liquid on it. So
Okay.
there could be liquids and pills and powder form as well. It comes in powder form as well.
So how is the homeopathy medicine when it comes to the COVID-19? Like, is there any recommendation or suggestion you can have, like how homeopathy can help? Or of course
Yeah,
we have vaccination, but I'm just
yeah.
saying, yeah.
In a COVID case, definitely homeopathy can help. I have seen a lot of COVID cases in the last 1 year. Um, um, but in the cases that I have seen, there was no complications in any of those cases. Became a complicated case, but it doesn't mean that uh, it, it it I can treat all the COVID cases because
Mhm.
there are many factors for the case to become complicated. The comorbid conditions the patient has, and the viral load really matters. How heavy the infection is. Fortunately, the cases that I have seen have a lesser viral load. That's they all recovered, and there is no magic pill for COVID cure in homeopathy. Just like the allopathy, we are treating symptomatically now
Mhm.
the COVID cases, just symptomatically, just like treating a flu virus,
Mhm.
because there is no specific medicine available there to target on this COVID virus. So just symptomatically we are treating, but there is nothing there to replace the vaccine in homeopathy. Vaccines, I still really trust on the vaccines, and because there are a lot of researches are done already, and so all the trials has been done. Vaccine is the final um, the way or the last resort that we have
Mhm.
to stop the spread of virus.
Mhm.
So nobody can claim, even if the homeopath is claiming that he or she has something to replace the vaccine, to avoid vaccine, it is wrong. There is nothing like that. because vaccine is very specific to targeting on this particular spike protein. But if there's a COVID patient, yes, we have a treatment. We could definitely treat that case. I think your microphone is switched off. Something happened. Okay,
Sorry about that.
okay.
The last question I have on the homeopathy medicine is, what are the common medicines like in terms of homeopathy? Like if you have to name some name, like in terms of homeopathy, what are the big common names in homeopathy medicine?
Yeah, many basically the pills those are the most popular and widely used, like ferrumphos, natrumphos, calcareaphos, natromure, silesia. Very very common. Silesia is basically because it's widely used for um, um, like alopecia and those kind of conditions. So it's very popular. Those are really popular. Nexvomica is another medicine. Trichinos nexvomica is a very popular medicine for gastric issues, alcoholism, and they're all really popular medicines. And Justicia is another medicine now is very popular because of the COVID-related respiratory issues. Seniga is another really important medicine for COVID-related respiratory issues. Yeah, it's hard to tell the names. Like it's a lot of medicines popular, but among those, the most popular are the tissue salts.
Okay. Okay, good. Thank you. I think we covered most of the homeopathy
Mhm.
questions. I just want to switch gear and move on to general health, basically the lifestyle.
Mhm.
Just a general health questions, nothing to do with specifically with homeopathy. But based
Okay.
on your experience, what are the common diseases or illnesses you are seeing these days, and what are the causes? Of course, we know the COVID-19, but in general,
Yeah.
when things were normal, like what you were seeing.
I would say mostly lifestyle diseases like high blood pressure, diabetes, obesity. Obesity is a pandemic, basically. So
Hmm.
obesity, a lot of cases of obesity, and we are seeing now. And then pediatric cases, pediatric eczema. A very good number of pediatric eczemas are there, childhood eczemas. Then repeated respiratory infections in children, very common. So parents are really bothered about it. Every month, this child is getting respiratory infections. So that's the adenoids, like nasal adenoids, polyps in kids. Those are really important, and and sometimes parents are worried that the child is not eating well, but in majority of the cases, just a worry, and there's not there may not be any truth in it. So patients are worried about those things, and in adults, apart from that, eczema is another issue in adults. Joint diseases like backache is a really big issue now. Yeah, muscle pains, backaches, arthritis, migraine. I am seeing a lot of migraine cases in my office. Yeah, those are the major I would remember.
What about the allergies? Do you see a lot of allergy cases?
Yeah, respiratory allergies in children, basically respiratory allergies, asthmas, allergic bronchitis, those kind of issues. We are seeing a lot of cases.
Okay, my next question is to have a better immune system, like to increase the boost your existing immune system, especially during pandemic. What food diet plan would you recommend? Like what food people should eat to
Yeah.
boost their immune system?
Basically, for the specific virus in the pandemic, there is no recommendation like that. There is no study there, but there are some evidences that vitamin D will help to shorten the duration of the virus infection, and vitamin C also can shorten the duration of the illness. But vitamin D we could take on regular basis, because vitamin D deficiency is pretty
It's
common.
very common, yeah.
Yeah, because we are not getting enough sunlight exposure.
Mm.
But vitamin C, there is no point in taking, but because there are a lot of patients ended up with renal issues because they were crazy eating vitamin C pills, because everybody thinks that vitamin C will boost up the immunity. But we cannot store the vitamin C in the body. It goes away by the urine. And again, it's very thermolyable. Vitamin C disappears with heating food. We don't need to take crazy amount of vitamin C, but I would recommend to take lots of citrus fruits to get
Okay.
vitamin C from natural resources.
Okay.
Even if you take plenty of vitamin C, it's not going to reduce the duration of illness. But there are studies showing that if you take vitamin C during that illness, it will reduce the course of the disease. So we do not need to take a lot of vitamin C on daily basis to improve an immunity to fight against the COVID-19. Other foods, we have to, I would recommend all the fruits and vegetables. We have to follow the food plate method. That's the best method. So in the food plate, 50% should be reserved for vegetables and fruits, raw vegetables and fruits. And the other 50% we have to divide for meat, nuts, and carbohydrate. And refined carbohydrate should be very minimal, like rice, wheat, those kind of things. In the rice and wheat, the issue is it has almost like 80% carbohydrate. And so by eating lots of rice and wheat, we are not able to reduce our daily calorie intake. But if you are reserving 50% of the plate with fruits and vegetables, so fruits has only 40% carbohydrates and vegetables 15% on an average. So, and they will give more fullness. They will give all the minerals and vitamins. So that's the best method rather than eating tons of vitamin pills, like multivitamin pills. If you do follow those food plate method, that will give most of the vitamins and minerals. But on the other side, we need proteins. We need around 40 grams of proteins every day for an average adult. So we have to have chicken, fish, like meat. I would say like healthy meat. Eggs, whites have high amount of proteins. They are very biologically active proteins we get from the egg whites, and from meat products and fish we get really high quality proteins, and from plant source also we get proteins. Why we eat more proteins? There's another question. Why we need proteins to improve the immunity? Then the immunoglobulins, the immune mediators in our body, all are proteins. So to manufacture those proteins inside the body, we need the building blocks, the amino acids. So whatever protein that we eat is splitted into amino acids, and they are storing in the racks inside the body. When the body needs an immunoglobulin to fight immunity, a specific immunity, it will immediately check the inventory. If there is one single ingredient missing, we're not able to manufacture it. So that's why we need high quality proteins in our plate every day. High quality proteins, nuts, they have most of the minerals. Then we should have dairy product to get vitamin E, and we need mushrooms and milk and those kind of things to get vitamin D, and so we need all of those. Then balance everything, and once in a while you can eat anything. I'm not going to tell you that you have to eat this food plate.
Yeah, right.
Like
balance of everything.
365 days. You don't need to eat like that, but you could have cheat days. But this should be the real pattern, and if you do like that, you don't need to eat all the multivitamin pills every day. But vitamin D I recommend, because the major source is sunlight, And because in Canada, we're not getting enough sunlight, especially during winter time.
Right.
Yeah.
Okay. So that's good to know. I just want to do a quick time check. We have probably another 10 minutes. So I just
Okay.
want to uh, go into the last session, which is we want to talk about aging
Mhm.
and basically healthy aging. So my question is, a 2015 publication by a team of international researchers declared it's time to classify biological aging as a disease.
Yeah.
So in general we say aging is a normal process,
Yeah.
but it seems the way I see is depending upon different people from different demography. We have seen people have lived for 116 years. We have seen people live in 80s, 90s. There is different variation. So I believe there are different reasons for that. One is the genetics, the other is the lifestyle. What is your take on this, aging as a disease?
Yeah, so that's a really good question. So assume that we invented a really good treatment for cancers, heart attack, diabetes. So those are the major killers, major diseases that the human beings are really suffering from. So if you have a really final treatment for all of those, then we are able to cure all those diseases. Assume that we have medicines for that. Even if we cure all of those diseases, probably we're gonna get a longevity like 10 more years. The total lifespan or the life expectancy may be like a little more higher, like 10 more years, the total life expectancy. But it will never make the life expectancy 150 years. It's not going to make it 200 years.
Mhm.
So the major killer is not those diseases; it's aging. Aging is nobody wants to be aged. So if we could conquer aging, that's the best way to live a healthy life.
Mhm.
And we have to understand that aging is not mandatory. We don't need to age actually, because aging is not something mandatory in the process of evolution.
Mhm.
There are many examples. There are organisms living for hundreds and 500 years, 200 years, 250 years. And there are some primitive organisms, they can't die. We have to destroy them. They will divide and multiply and grow like that. So
Mhm.
the aging and death was actually uh, recorded in our DNA as a separate program in the process of evolution.
Mhm.
If that program was not there, we're not going to die.
Mhm.
So that was an additional program written in our DNAs. So we don't need to we don't need that actually. So it's not something against nature. I would say against nature. It's not something mandatory.
Mhm.
So I would say that maybe there that we don't. I don't say that we have to completely switch off the death program, but it's not far away that we would think that death is optional. I have to choose it. If
Mhm.
you do not choose it, you leave. So
It's
it
interesting. I was
becomes like,
reading. Mhm.
sorry.
I was reading about the aging, and I found there's a place somewhere in China where there's one village where most of the people tend to live like 100 plus
Yeah,
age,
yeah. There
right?
are genetic factors out there. So
Yeah.
every time when our cell multiplies, there's a small area in the chromosome. There's a telomere, so it becomes
Mhm.
shorter. So that's one reason for the aging. So if we can manipulate that area, that is the best way to stop aging.
Okay.
So researchers are going in that direction. Um, and finally, there will be a magic pill available in the market, so or like a treatment available, so that we can stop the aging because our cells are multiplying and making fresh cells.
Right, right.
Yeah, we don't need to die or we don't need to age like that. So that's why it is considered. And age is one of the major cause for disabilities, quality of life issues. All are related to aging. Like if I'm not aging, I don't need this class. So we need a lot of supportive things too, because of the aging. Then what homeopathy could do for aging? That's the next thing. There are until now we don't have any final answer for that. But in homeopathy, there is a traditional treatment that's known as constitutional treatment. So it's a kind of it's hard to find a constitutional remedy for a particular individual. Sometimes it is frustrating for the patient because we should know all the history of the patient, their lifestyle, their eating habits, their family life, everything, and we have to put everything into a chart. And there's a special algorithm to find a tailor-made medicine remedy for them. And if it is a really well-selected one that has impact in all the tissues of them. So we have computer programs now. I really love to have AI and other machine learning and those kind of technologies should incorporate in selecting the constitutional remedy. And if it could do something for aging. So that's my wish. And there are other products already in the market, like resveratrol is considered to be anti-aging in animal models, and it's available for prescription now. It's available in the market, and there are many products already out in the market. Studies are there, but not very conclusive. Yeah, but still, that's a dream.
Okay. I always think, getting older is natural, thinking older is optional. And, at whatever age, 90 or 100, you still can, your memory is strong enough to at least remember your childhood. But if we can keep our mind young, why can't we keep our body and skin young? There must be a way to extend our lifespan, right?
Yeah, because we do have a cardiovascular reserve and a neurological reserve. We often see that some people die at age of 60s or 65s with a heart attack, but they are highly productive in their memory and their brain, but no use. Heart stop humming. And some patients live up to 90s, but their memory and mental functions and neurological reserve is less. So they get dementia, Alzheimer's at 60, 65, but still heart is pumping, they are living.
Sure.
So only very lucky people get both them good together. So they have to deteriorate in the same way. But mind is basically a function of the brain. So there is nothing like standalone mind. So if we could stop the aging, then our neurological capacity will stay the same. So we will be mentally alert and physically alert. That's the final goal.
Yeah, good to know. It's been really an informative session, no doubt. Even a lot of things I didn't know, like today I'm learning, and hope the viewers also get a lot of insight about it. Pretty much I am done with my questions. I just want to thank you for accepting my invite and talking about all these topics. I just want to, if you want to say anything to to the people, whoever is watching, about your practice and how they can reach you, you're more than welcome to talk about that.
Yeah, thank you for that. And thank you for inviting me for this session. And
Thank you.
yeah, my office is in Kitchener, Waterloo area, basically in the Kitchener. Now, because of the pandemic, I have a home office for virtual consultation, but now I am receiving patients there as well. That's a separate, we have arrangement and separate entrance and all those sidewalks in there to come to my office. So I'm pretty much available a little bit in the late hours because this is my home office. We have a virtual consultation, and in physically, they can, if they want to come in physically, and of course there are all the guidelines we have to follow, and on the COVID guidelines protocols we have to follow. And once the pandemic is over, and we will be fully open for physical consultations. And I have one office in Brampton, but now I'm doing only virtual in the Brampton office. But otherwise, I'll be there in the Brampton every weekly once. Like mostly, it was Friday was my Brampton day, but after the pandemic, it may change. It may change. So my office is close to the boardwalk in the Victoria and Iron Needle intersection. That area, my office. It's anybody can, if you want to book appointment, just call my office, and if you Google my name, Sajeev Ampadi, you could get all the information about my office, working hours, everything. Just Google, and you get all the information from there.
Okay, good. Thank you so much for your time. I really appreciate that. And I just want to end by saying, thanks for watching Namaste Debate. And probably later on, this live will be available offline too. You can watch the video. And I just want to thank Sajeev again. Thank you. We'll talk some other time over the phone.
Okay, thank you very much.
Thank
Have a
you.
great weekend. Thank
Join
you.
Namaste. Yeah, thank you.